It makes me feel sick to my stomach. Like I have literally tasted stomach acid in my life already. You have it forever. You have it for life.
Hey, it's Jay Leanne. Rhymes with A Leanne. Like if you're a fan, comment and subscribe.
Hello, my name's Jillian. Let's get started.
What is GERD? Overview. Gastroesophageal reflux disease, GERD, occurs when stomach acids frequently flows back into the tube connecting your mouth and stomach, esophagus. This backwash, acid reflux, can irritate the lining of your esophagus. Many people experience acid reflux from time to time. GERD is mild acid reflux that occurs at least twice a week, or moderate to severe acid reflux that occurs at least once a week. What causes GERD? There is no known single cause of gastroesophageal reflux disease, GERD. It occurs when the esophageal defense are overwhelmed by gastric contents that reflux into your esophagus. This can cause injury to tissue. GERD can also be present without esophageal damage. Approximately 50-70% of patients have this form of the disease. Gastroesophageal reflux occurs when the LES barrier is somehow compromised. Occasional reflux occurs normally and without consequence, other than infrequent heartburn in people who do not have GERD. In people with GERD, reflux causes frequent symptoms or damages the esophageal tissue. Symptoms. Common signs and symptoms of GERD include a burning sensation in your chest, heartburn, usually after eating, which might be worse at night, chest pain, difficulty swallowing, regurgitation of food or sour liquid, sensation of a lump in your throat. Risk factors. Conditions that can increase your risk of GERD include obesity, bulging of the top of the stomach up into the diaphragm, hiatal hernia, pregnancy, connective tissue disorders such as scleroderma, delayed stomach emptying. Foods that might make GERD or reflux esophagitis symptoms worse include meat, as it tends to be high in cholesterol and fatty acids, oils and high fat foods, which may cause the sphincter in the stomach to relax, high quantities of salt, calcium rich foods such as milk and cheese, which are sources of saturated fats. Other food flare ups. There are additional foods that typically cause GERD flare ups, which doctors often recommend people with this condition to avoid. These foods include chocolate, mint, carbonated beverages, acidic drinks such as orange juice and coffee, caffeine, acidic foods including tomato sauce. Treatment consists of self-care and antacids. Relief from lifestyle changes and over-the-counter medications is usually temporary. Strong medication may be needed. Self-care. Elevate head of bed, dietary modification, and weight loss. Medications. Antacid, proton pump inhibitor, and antidiarrheal. And now I will be telling you about my experience with having GERD. So here we go.
So basically, GERD has done a lot to me. And I remember the incident when I was younger with hot dog and ketchup, and me being really, really sick at 12 years old and not knowing exactly why, and basically because of the acid in tomatoes, since tomatoes are very acidic, and People with GERD are just not supposed to eat tomatoes like that. Like, some people could eat it once, twice, 3 times a year. Who knows? Everyone's case is very different. And as for me, even pizza, like I'll eat pizza once or twice a year, probably not even. GERD is like that. And yeah, when it comes to eating foods, like lemons sometimes are just not good. Orange is just 100% not good for me. Like I just can't do orange. Like it makes me feel sick to my stomach. Like I just thinking about it. There's so many foods that I just cannot handle. And when people find out about that, is like they act all strange. Like there are illnesses out here like this, and even probably worse. And plus, let me not even get started about the acid that has gotten into my esophageal lining and burnt my throat. Like I have literally tasted stomach acid in my life already. Stomach acid messes up the teeth. It does a lot of damage. And the research I did online talking about GERD, I feel as though it wasn't really giving the truth about it. It's saying that you could just take treatments and you'll be fine and all this stuff, but living with GERD, it's a nightmare. It's a horror story. Some people control theirs, like me for instance. I've had it under control. I've had an attack yesterday for... Really? I had an attack yesterday, but it was only for like 3 minutes. And it's been months since I felt GERD. Months. So for some people it is easy to handle. For other people it is not easy to handle. Some people medication doesn't even work. People do get cancer from GERD. People could die in their sleep from choking. Like the internet is making GERD seem like it is a soft stomach disorder that you can live with, but it is not. And I could tell you that I have cried over foods that I have loved, foods that I have really, really loved, and I had to just toss in the trash, give it up, because my stomach was telling me, no honey, no. I had to give up foods that I love because my stomach just couldn't handle it. So the internet really needs to change some of that information, because when I did research, I had to do a lot of research. GERD cannot be cured. When you have GERD, you have it forever. You have it for life. It is a sickness in itself. And not only do I have to deal with that, but I also have to deal with scoliosis as well. So people who are like me, some of us suffer a lot. Some of us suffer mildly. Some of us, it's almost non-suffering, you know, but there's still something there for every person. There's still something there. Basically, I wanted to come and just also talk about GERD as well, and really show how people really suffer with it. And with that said, don't be too problematic. Be as polite as possible. I'll see you next time.